So on the one side, it's political expediency, and that's the more cynical view of it.
Yeah, I mean, I think a lot of people would prefer, businesses certainly would prefer, that the Supreme Court weigh in and we get an answer one way or the other. I've worked with many businesses over the years, and the one thing I hear consistently from businesses, whether it's a small single provider clinic in a rural area or in conversations with CEOs of major managed care and pharmaceutical companies in the United States, the one thing they all say is, I want consistency. Tell me what the rules are. Tell me what I have to do in order to meet whatever rules you're going to put in place, and then let me do it. Get out of my way. And right now where we are is there's tremendous uncertainty. Will I as an employer have to provide insurance? If the whole law is made unconstitutional, I will have spent money perhaps for something I didn't. And so the uncertainty is really going to have a chilling effect on businesses in terms of, do I hire an employee or not? What do I do? What are my cost exposures going to be? How do I price a product, not knowing what some of my cost exposure might be moving down? So I think if for no other reason than to afford the states, the businesses, and individuals a degree of certainty, it would be best for the Supreme Court to weigh in sooner rather than later.
Just before we take a quick commercial break, do you have any prediction on whether you think this will get fast-tracked or not? Or
I don't. I've listened. I know the Attorney General of Virginia pretty well personally. I've known him since before he was Attorney General, and he and I have had a chance to talk. He doesn't know. I mean, it's one of those things that could go either way. So you're really trying to get into the head of the individual justices, and that can sometimes be a dangerous proposition. So
sure.
No, I really don't know which way it'll go.
Most certainly so. Listen, we're going to take a quick break to hear from our friends from the Chester Company, but when we come back on the Healthcare Business Network, we are going to talk to our guest, Bill Finerfrock, about tort reform, which is an extremely important issue to so many people at hospitals, private practices out there. And we'll be back in a moment.
Revitalize the image of your practice with marketing and communication services from the Chester Company. We specialize in helping you communicate effectively with your patients. Whether it's a patient handout that announces a new service or a new website where your patients can conveniently make their own appointments, the Chester Company is here to help you present your practice and its services in the best light possible. Let us show you how. Call for a free, no-obligation consultation. 860-526-9903. 860-526-9903. Call now.
And we're back here on the Healthcare Business Network. I'm Ron Nyman. And just to let everybody know, my email address for any comments, questions, or suggestions for future shows, because we do read all the email that's been coming into us. The email address is Ron, that's R-O-N, at hbnradioshow.com. That's Ron at hbnradioshow.com. And we're back here with our guest, Capitol Hill legislative expert, Bill Finerfrock. And we're talking here about Obamacare. And the next question that is a question, of course, is not surprising on a lot of doctors' minds, for so many years has been tort reform. And, of course, that gets to the issue of, I guess most doctors will say tort reform, that means a cap on damages for pain and suffering and the like. What do you think are the prospects for tort reform? What's been going on? What do you think the prospects are in terms of this time it'll get done?
I think it's been interesting. The president has on a couple of occasions now indicated a willingness to look at the tort reform issue. There was some language in the underlying Patient Protection Affordable Care Act establishing some demonstration initiatives. I think it's going to be interesting to see where this one comes out. If there is any opportunity for doing some meaningful federal tort reform, I think it's going to have to happen in the first 8 or 9 months of this year. In other words, sometime before September. As you know, and your audience, I'm sure if they're following this knows, the trial lawyers have historically vehemently opposed any type of tort reform legislation particularly as it relates to caps on damages, the non-economic damages, things of that nature.
And they've had the support, I guess, primarily of the Democratic Party over the years. Is that correct, or is that oversimplifying it?
Look at campaign contributions. They probably are disproportionately going to Democrats rather than Republicans. I don't think that's, it's never an absolute, but I'm certain if I were to pull up the data, it would show that overwhelmingly they're going to Democrats and presumably those who are on some of the key committees. And that's not going to change. The significance of those campaign contributions become more and more important to people the closer they get to an election. So that's why early in the term here, if we have an opportunity, if there really is a serious opportunity for tort reform, I think it's going to have to occur in the early part, sometime before September. Otherwise, we're getting more and more into the political season, which would be next year, and the prospects for doing something of this nature in an election year become very slim. So I hope so. It's something that a lot of folks have talked about at the federal level, and certainly a number of states have taken steps, and it appears that at the state level, when they've done things, caps on non-economic damages, things of that nature, that you've seen some significant improvement in terms of premiums, and also the psychological effect it has on providers in terms of what's often referred to as the defensive practice of medicine, the feeling that, well, okay, maybe I don't need to order this test, that because I'm not going to be as worried about being sued, things of that nature. So it goes beyond just the economics of a premium, but how does it affect the practice of medicine and the decisions that providers make in terms of what to order or not order, and the ability to help to reduce some of the cost of healthcare by eliminating unnecessary tests.